welcome to the first in, I haven't found a good name yet, so what I'm calling the Cancer Diaries, until I can think of a better name. So if you've got a suggestion, please do let me know. But why am I doing this? Having had some significant life events in the last few months, I thought it was worth just recording really the events, how I'm feeling, everything as it unfolds, so that hopefully in many years to come I can look back and remember. But also potentially this might be of use to somebody else, so if I put this out there as a blog or a vlog, there might be somebody who's going through something similar who might find it helpful. So where to start then? Probably starting pre-diagnosis. So 2018. 2018 was a mad year. I turned 46, I ran a marathon, I got cancer and I lost a kidney. That's kind of the highlights. 2018 started out quite difficult. Some hard personal stuff going on, which was stressful, sad, frightening, difficult to deal with. But despite that, or maybe because of that, I don't know, lots of other things went incredibly well. So professionally, things went really well in 2018. I was doing well in my job. I'd started my doctorate, passed the first two parts of that. I do amateur dramatics and I'd been in two amazing shows. So the first one was Starlight Express, which I never thought I'd do. Dusting the roller skates off again after a few years at home. But yeah, amazing to get to be in that show. And then towards the end of the year, Chitty Chitty Bang Bang, which again, amazing show to be a part of. And I got to play a really fun character, the Baroness. So professionally, hobby-wise, things were great. And from a kind of a personal fitness perspective as well, probably the best year I've ever had. So my physical health, my physical fitness were really good. I'd started running in 2016, did couch to 5k, and managed the odd park run after that. 2017 started to take it a little bit more seriously, so did my first 10k, entered the Great South Run, so did 10 miles, and then after that did a half marathon. So then 2018 came along and I thought, really go for it this year. So I trained for a marathon and completed it in 4 hours and 45 minutes, which I was really chuffed with. And I'd been running regularly, I'd been going to the gym, doing lots of yoga, lots of circuit training, so I felt fit, I felt healthy. And then in November, out of the blue, cancer. Okay, so diagnosis then. Now, as I said, I'm completely fit, healthy, well, prior to my diagnosis, and it's really difficult to believe considering I had a really quite advanced tumour, but that's how it is. Essentially, completely fit and well until the middle of November when I was at work and I just couldn't pee. Out of the blue, went to go to the loo probably about midday-ish, and nothing would come out. Really weird sensation because I really wanted to go, but just as much as I was trying, just it wouldn't work. And I started to be able to get literally a couple of drops might come, and with it some blood clots, which was obviously quite alarming. So anyway, I managed to get hold of the triage nurse at my GP's practice and told her about the symptoms that I've been having, and she suggested I might have a urinary tract infection. I wasn't convinced because I didn't have any of the other signs and symptoms that you would normally get with an infection. I didn't have a temperature, I didn't have any, prior to not being able to pee, I hadn't been having any pain when I was going to the toilet, I hadn't been needing to go much more frequently or anything like that. So I thought it was quite unlikely, but it was a possibility. So I was happy to go along with the plan, which was start some antibiotics, take 3 days worth of antibiotics, and then see how things went. They also wanted me to drop a sample in. So this was kind of carrying on. I was still really finding it very difficult to actually pass any urine at all. But that evening, I got a bottle to put the sample in, and I actually managed to go. But what came out was really bloody, and that was quite worrying, obviously. So anyway, I had my sample ready, and I thought I'll try maybe see if I can get another one in the morning. It's always better to get an early morning sample if you can. A nice clean sample to take in for them to test for bugs. So the next morning I did do another sample, and by this time I was peeing completely normally, no problems at all, no pain, nothing. I did another sample and it looked a much more normal colour, maybe slightly dark, but it certainly didn't look red or pink or anything like that. So I did this sample, took that one in, got the prescription for the antibiotics and started the antibiotics. This was a Friday, so the plan was take them over the weekend and then do another sample on Monday, take that in and go from there. But as a nurse, I was worried about, what else it could be. I'd worked in urology and I'd seen, quite a few people that had problems with not being able to pee, but most of the time it was men with enlarged prostates, really much more unusual in women. And I remember one of the things that it could be is neurological, so it could be something like multiple sclerosis. So I started to worry about that, but then I thought, well, that doesn't explain the blood, so what else could cause blood? So stones, I know that you can get stones, and stones can block the passage of urine. And if you get stones, they can cause tears, they can cause trauma, so maybe it was a stone. But when you get stones, you often get a lot of pain, and really, really bad pain, particularly if they're kidney stones. So you would have expected me to have had some pain if that was the case. But you can get bladder stones as well, so maybe it was one of those. But then I also started to think, well, maybe it was a tumour. So you can get tumours anywhere in your urinary system, but particularly in your bladder and in your kidneys. So I started to wonder about that, and then I also looked up the clinical guidelines for what you should do if somebody presents with blood in their urine. And the national guidelines from NICE, so the National Institute for Health and Clinical Excellence, have some really clear guidelines. If you've got visible blood in your urine, if you're over 45, and there's no signs of infection, then you should be referred under a cancer pathway, a 2-week wait to be seen for suspected cancer, urological cancer, so bladder or kidney. And at this point I didn't know if I had an infection or not, although I suspected I didn't. So this is where it really started to make me think that this really could be a cancer. So anyway, I knew there was nothing I'd be able to do until the Monday till I'd finished the antibiotics. So over the weekend I was just waiting, and then on the Saturday evening I think I was probably watching Strictly, but I was lying on the sofa and I thought, I'm just going to have a little feel, and I felt a lump. And it was a big lump. And it was a real oh fuck moment. So I think, how have I not felt that before, because it was really big and it was really obvious. But actually, just by kind of rubbing the skin, you couldn't feel it, you couldn't see it. It was only when actually kind of pushing in to the stomach that I could actually feel this lump there. And it was huge. It was from kind of the middle all the way around to the side. And when I pressed on it, you could feel it pushing out at the back as well. So that that was it. My heart absolutely sunk at that moment in time. But I was desperately trying to think, what else could it be? So or could this be? I'm really constipated, and this is just bowel, or could it be swollen kidney, hydronephrosis? All these things. I'm trying to think, what is it? What is it? What is it? But I kept coming back to, this could be a tumour. I might have cancer. But there was nothing I could do until Monday morning. So Monday came around, and I managed to get hold of my well, I was waiting for the nurse to ring me back from the GP surgery so I could, find out what to do next, expecting to get referred under the 2-week wait. And I couldn't pee again. So again, out of the blue, I was trying to go to the toilet and nothing was coming out. So by the time I got to speak to the nurse, I was really panicky. I couldn't pee. I'd obviously had found this lump. I'd read the 2-week wait guidelines, and I was really scared. And when I told the nurse about the lump that I'd found, she told me to come in and see the GP as an emergency. So I managed to get in and see the GP, who was just lovely. She was amazing. And I explained all of the symptoms that I'd had, and I explained that I'd found this lump. And she examined me and she felt the lump, and I could see in her face that she knew this was significant. But she said she wasn't sure, was it kidney, was it spleen, what could it be, but she did want me to get seen. And she suggested that she could refer me under the 2-week wait guidelines, or she might be able to get me seen that day by one of the surgical team at the hospital. And obviously, I didn't want to wait, so I said, if she could get me seen, that would be great. And she managed to speak to the urology team, and they agreed they would see me. So I went in, still not peeing at this point, and I saw the most amazing registrar. He was just absolutely incredible, very, very calm, very clear in his communication, very caring, and he didn't hold anything back. I told him that what I do. I'm a lecturer in nursing. My background is critical care nursing. That my symptoms, what I found. That I used to work in urology, etc., etc. So he examined me, and I could tell from his face as well that what he'd found was significant when he felt my abdomen, and he prepared me really for that this was likely to be bad news. He suggested that we would try to get a scan as soon as possible. I still wasn't peeing at this point, so he suggested that if I couldn't pee, that they would keep me in, and I'd have a scan done sort of urgently. But if I did manage to pee, I could go home and come back and have it done. And then I did. I managed to go, and again I peed a huge amount of blood, but this time it looked like a red wine. Again, really, really quite alarming to see it. But at that point I could pee, so there was no need for me to stay in, so I went home. Shouldn't have done really. And then I went to work the next day, and again I shouldn't have done really, because at work again I suddenly couldn't pee, but this time it was absolute agony, to the point that without boring you with the details, I had to get a colleague to drive me into the emergency department at the hospital, where they put a catheter in me, which was the most blessed relief. Oh my god. I had nearly 2 litres of urine in my bladder, which is only really supposed to take, 500 mils or so, maybe, half a litre to a litre. So having 2 litres in there, it was really quite painful. And from that point on, I stayed in hospital because I had to have a catheter. I couldn't go home, and they managed to get me in for a scan within a few days. So I went down for the CT scan, and they weren't just scanning my kidney, they were scanning all of my abdomen and my chest, which I knew they were looking for. They were expecting to find a tumour in my kidney, and they were looking to see if it had spread anywhere else. So I had the scan done, and then the next morning, the doctors came to see me, and it was the lovely registrar who, as I said, was brilliant, and he remained brilliant the whole way through. And he came into my room with, I think, another couple of doctors, but he had 2 nurses with him. And so I knew straight away, doctors always bring the nurses in with them when they're going to break bad news. And he told me straight that they had found cancer. They'd found a tumour, large tumour in my kidney, and they had seen some enlarged lymph nodes, but there wasn't any sign of any cancer anywhere else that they could see. And as I was kind of expecting to be told I had a tumour, but to be honest, I was also expecting to be told that I had tumours elsewhere. The size that I thought it must have been there for months, and if it's been there months, it must have spread. You know, this must be really, really quite advanced. So to hear that they couldn't see any other tumours elsewhere was just, I just burst into tears at that point, because it was just, I kept thanking them because it felt like amazing news. So that was my diagnosis. And then from then the plan was to take the kidney out, take the tumour out, take the lymph nodes out, and then go from there really.